This is adult assessment. So the first thing I'm going to do is I'm going to gather my supplies. So I have my blank piece of paper, my pencil, and then my vital signs equipment. Hi.
Hello.
Hi, I'm Amanda. I'm going to be your nursing student for today. I'm going to perform my hand hygiene. Can you please tell me your name and date of birth?
Roy Bender, 11/13/60.
Okay. Are you allergic to anything?
No, I'm not.
Okay. So the reason why I'm here today is to perform a head-to-toe assessment on you. The reason why we're doing a head-to-toe is to detect any medical abnormalities that may need some further medical attention that you may not have spotted yourself. A head-to-toe assessment is where I look, listen, and feel to all of your body parts. So if you're uncomfortable during any part of the assessment, please let me know.
I will.
Okay. Before I begin, do you have any cultural or spiritual beliefs that may impact my care?
None.
None? Okay. So, can you tell me about your relationships and how you've been feeling emotionally?
I have very good relationships and I feel well emotionally.
Okay, well that's good. Can you tell me how you handle stress?
I go to the gym and work out.
Okay, well that's good. That's good that you're working out. That's a great part of health promotion, just working out and improving your cardiovascular health to help make you feel better emotionally. Okay, so now I'm gonna grab a set of vitals if that's okay.
Okay.
Okay, so I'm gonna grab a blood pressure. Do you have any implanted medical devices in that
No, I
order?
do not.
Okay. This is just gonna squeeze your arm. It's gonna tell me how hard your heart is working currently. I got 120/74. So the blood pressure was 120/74. I'm going to get a temperature, a pain assessment, an oxygen saturation, a pulse, and a respiratory rate. Okay, I'm just going to grab your temperature and oxygen saturation. So this just goes on the finger, it's a pulse oximeter, and it measures your oxygen. And this is a thermometer, it just goes on your head. Okay, 98.6. Okay, I'm just going to take a feel of your pulse. So his respiratory rate was 16, his oxygen saturation was 90, and his pulse is 71. It was 71, non-30, 2 plus. On a scale of 0 to 10, 0 being no pain, 10 being less pain, how would you rate your pain?
0.
A 0? Okay. Okay, so I'm just going to ask you some silly questions, but they do have a purpose. It's to help me assess your medication. Okay, can you tell me who you are?
Roy Bender.
Can you tell me where you are?
At the hospital.
Tell me what time it is?
It's around 4 o'clock, I think.
Okay. Can you tell me the situation?
I'm having a patient assessment.
Okay, so based on his answers to my questions, I can say that he's conscious, he's alert and oriented to person, place, time, and event. He is able to answer my question and comply to commands appropriately. His speech is monotone and fluent. His mood is calm when the effect is a relaxed body language laying down. And his auditory acuity, he can hear me speaking at a moderately pitched voice. So my general impression, he is well groomed, he's wearing clothes that are appropriate for the weather, he doesn't have any foul body odors coming from his mouth or his body, and he's sitting at a semi-fowler's position, very relaxed and not in immediate distress. Okay, so now I'm going to go ahead and begin the assessment. So I am first looking at his head for size, shape, and symmetry. So I'm just gonna feel your head and make sure that there aren't any deformities and things that need medical.
Okay.
So can you please lift up your head for me? Thank you. I'm just palpating for deformities. Let me know if you're tender. So his head size is proportional to his body. His head is symmetrical, there's no deformities. And the head shape is normal cephalic, with no deformities present. His hair is non-patchy, there are no infestations, and it's well groomed and maintained. Were you tender?
No.
Okay, so now his overall appearance, he appears well groomed, he's not in distress, he appears calm and relaxed. I'm going to palpate your sinuses now. Let me know if they're tender. Are they tender?
No, they're not.
Okay, now I'm going to assess your facial function. So can you smile real big? Can you frown real big? Can you stick out your tongue? Okay, so his face is symmetrical. He has full range of motion for movement, and there are no deficits. So now I am going to assess your eyes. I'm going to shine a light in your eyes. This just helps me to assess your reactivity, of your pupils. So I'm looking at your eyes. Okay, can you focus on my pen right here, and then something behind me? So his eyes, or his pupils, are equal, round, reactive to light and accommodations. I'm observing all parts of his eyes. So his eyelids are non-swollen, his sclera is white, his conjunctiva is non-tender, and his conjunctiva is pink, and there's no nystagmus or strabismus present. Now I'm looking at his nose. His nose is symmetrical. Can you breathe well through your nose?
Yes.
Okay. And I don't see any compromised skin integrity. His skin is clean, dry, and intact. So now I am going to move on to the ears. I'm going to have you turn that way. So I am looking at the ears. His skin integrity is clean, dry, and intact with no lesions, and the color is appropriate for his ethnicity. I'm going to palpate for tenderness. Are you tender?
No.
And now I'm going to look for drainage. I don't see any drainage present. Now you can turn your head and I can assess the other one, please, and thank you. So his skin is clean, dry, and intact with no lesions. The color is appropriate for ethnicity. Now I'm going to palpate for tenderness. Are you tender?
No.
Okay, and I do not see any drainage present. Okay, so now I'm going to assess your mouth. So I see that his lips are pink and moisturized. Can you open up, please? So his uvula is midline, the color of his gums and his mouth tissue is pink. His mouth is well moisturized. His dentition, he is well groomed. He does not have any chipped teeth. There are no lesions present. Do you wear dentures?
No, I don't.
Okay. Do you have any concerns regarding your mouth?
No.
Okay. Mouth is pink and well moisturized. Dentition is well groomed with no chipped teeth. His uvula is midline. There are no lesions, and he does not wear dentures. So now I am going to assess your neck. Okay, I see that his trachea is midline with no JVB present. There are no visual masses, Gonier, or swollen lymph nodes. I don't see any of that. Have you had any difficulty swallowing or problems with your
No,
throat? No? Okay. So now I am going to palpate your carotid artery. So you can look up and then hold to right. Okay. Carotid artery is present, 2+, no JVB present. And you can look the other way now. I'm going to palpate the carotid. So carotid artery is present, 2+, no JVB present, and I'm going to palpate your lymph nodes. Please let me know if you're tender.
Okay.
Are you tender?
Yeah.
Okay. Lymph nodes are non-palpable, and I'm going to assess your neck. There are no masses, Godier present based on palpation. So, have you had any changes in your vision?
No.
Do you have any concerns regarding your vision, your health?
No.
Have you had any changes in your sense of smell?
No.
Have your ears been ringing or causing you any problems?
No issues.
Okay. So now I am going to move on to your arms. So I'm inspecting the arms. I'm looking at his skin integrity. So his skin is clean, dry, and intact. The color is appropriate for his ethnicity, and there are no deformities. So the skin on his right arm is clean, dry, and intact. There is no deformities, and the color is appropriate for his ethnicity. So I am now looking at his fingers. So he does not have any swollen joints, and his fingernails are well maintained and not clubbed. So now I'm going to assess circulation. So I'm going to assess your bilateral radial pulses. Equal 2+ bilaterally. I'm going to assess your capillary refill. Okay, less than 3 seconds on his left arm for all 5 fingers. Okay, less than 3 seconds on his right arm for all 5 fingers. His skin temperature is warm to the touch. And now I'm going to assess your motor function. So can you squeeze my hands? So his function, he has equal grip strength, and now I'm going to assess your fine motor skills. So can you go like that for me? And go like that. Has full range of motion on his fine motor skills, and now I'm going to have you sit up. Thank you. I'm going to assess your gross motor skills. So can you reach up? Can you reach down? Can you do circles? So he has full range of motion on his gross motor skills. Are you experiencing any pain or stiffness in your joints while you move?
No, I don't.
Okay, so I'm observing his muscles are even and symmetrical in size, and now I'm going to palpate. So let me know if you're tender. Are you tender?
No.
Okay. Non-tender on his left arm, there are no palpable deformities, and no swelling noted. So now I'm going to do the other arm. Let me know if you're tender. You tender?
No.
No palpable deformities or masses, and he is not swollen. So now I'm going to assess your sensory. So I'm going to have you close your eyes, and I'm going to touch one of your fingers, and you can just tell me which one I'm touching.
First finger.
Okay. What's that?
Thumb.
Alright, he has full sensory, and now I'm going to ask you some questions. So, have you had like any neck pain or shoulder pain?
No.
Do you have any concerns that you
No.
need to talk to me about? No?
No concern.
Okay, so now I'm going to assess your back. So, I am going to look at his skin. So his skin temperature is warm. So his skin color is appropriate for ethnicity. I don't see any signs of trauma like deformities, contusions, abrasions, penetrations, burns, lacerations, and swelling. His skin is clean, dry, and intact. His spine is within midline. I don't see any surgical scars. I'm gonna palpate for tenderness, okay? You let me know if you're tender.
I will.
Are you tender?
No, no issues.
So no tenderness and no lumps present. Have you had any back problems or like back surgeries recently?
No.
Do you have any concerns regarding your back and your spine?
No.
Okay, so I'm gonna have you lay back down. Now I'm going to do my chest assessment. So I see that his breathing is non-labored. He has equal and symmetrical chest rise and fall. His positioning, he's in a 45-degree medium low Fowler's position. His chest is symmetrical and proportional to his body shape. He doesn't have a barrel chest or anything. And I don't see the use of accessory muscles, and he is not tripartite. So now I'm going to look at the skin integrity on your chest. So he does not have a port or a pacemaker present. His skin is clean, dry, and intact, and the color is appropriate for his ethnicity. Okay. Have you had like any shortness of breath or chest pain recently?
No, nothing like that.
Do you have any concerns regarding your like heart and your chest? No. Okay. So now I'm going to auscultate your heart sounds. This is the aortic at the right-hand side of the second intercostal space. Okay. This is the pulmonic at the second intercostal space, left-hand side. This is Berg's point at the third intercostal space, left-hand side. This is tricuspid at the fourth intercostal space, left-hand side. This is mitral or bicuspid at the fifth intercostal space, left-hand side. Okay, now I'm going to listen to the point of maximum impulse for 60 seconds. And I'm starting now. So S1 and S2 were present, regular rates and rhythm. Okay, so now I'm going to listen to your lung sounds. So I'm going to have you sit up again, please. Thank you so much. Just breathe normally. If you feel lightheaded, you can go ahead and lay back down. lung sounds were clear bilaterally on the anterior aspect of his body. Now I'm going to listen to your posterior lung sounds. You can breathe in. His lung sounds were clear bilaterally on the anterior aspect. So do you smoke at all?
No, I don't.
Okay, well not smoking is really good. Smoking can really damage your lungs and it can cause COPD, which stands for chronic obstructive pulmonary disease. So that's good that you're not smoking. Keep up the good work.
Okay.
Okay, so now I'm going to assess your abdomen, so you can go ahead and lay back down. So I'm inspecting his abdomen. I'm going to do the skin integrity. The skin is clean, dry, and intact. The color is appropriate for his ethnicity, and he does not have any deformities or hernias present. So I'm now going to auscultate your vowel sounds starting in the right lower quadrant. He had active vowel sounds in all four quadrants. If they were hypoactive or absent, I'll listen up to 5 minutes in each quadrant. Also, when I auscultate, it will be preferred if I put my diaphragm of my stethoscope to their skin, but since he's uncomfortable with that, I compromise with him and I'm listening over a light t-shirt. So now I am going to palpate. Let me know if you're tender or if you experience pain. Okay. Were you tender at all?
No issues.
So he did not have any distension or rigidity on palpation, and he told me that he was not tender. So now I'm going to palpate your bladder. Please let me know if you're tender.
Okay.
Okay. So he wasn't tender and his bladder wasn't distended. Did you experience pain while I palpated your bladder? No. No, okay. So can you tell me about how your stools have been looking like recently?
In the summer.
Okay. Do you have any concerns regarding your stomach?
No, no.
Okay. So how have your bowel movements been like?
Very good.
Very good. Okay. So like how have they been scheduled? Are they pretty regular or
Yes.
do you?
Not today. No.
Okay, that's good. So now I'm going to do a genital urinary assessment on you. If you're uncomfortable, please let me know. So do you have like any rashes down there or any problems that you'd like to talk to me about? No? Okay. How have you been experiencing burning while you've been peeing?
No.
Okay. Can you tell me about your characteristics of your urine?
Clear.
Clear? Okay. Is it like a yellow or like
Clear
a
yellow.
clear yellow? Okay. So now I am going to do my GU assessment. I'm going to go on the mannequin, but let's just say it's the real person. Okay. While I'm doing my GU assessment, I'm looking for any rashes, compromised skin integrity, foul odors, or foul smelling discharge. Any deformities present, and yeah. I'm going to look at the coccyx, the lower back, the perineum, and the genitalia. So I'm looking at his skin integrity. So his skin is clean, dry, and intact. He maintains this area very well. His skin color is appropriate for ethnicity. I don't see any redness or swelling, no parasites, no foul smelling discharge or odors. His hygiene is well maintained. All right, I'm gonna turn you 1, 2, 3. Okay, so I'm looking at his coccyx, his lower back, his perineum, and his buttocks. So there are no parasites, no foul smelling discharge or odors. His skin is clean, dry, and intact, and well groomed and maintained, and the color is appropriate for ethnicity. There are no deformities present, and no rashes present either. I'm gonna put you back down. So now I'm going to assess your lower body, your range of motion with your lower body, your skin integrity, and all of those things. So I'm gonna have you roll up your pant legs, please, if you can. Thank you so much. Okay, so his skin temperature is warm bilaterally, so he's warm bilaterally. His skin integrity looks clean, dry, and intact. I'm going to grab a closer look. Can you look this up? Thank you. Clean, dry, and intact with no deformities present. The color is appropriate for his ethnicity. You can go ahead and put that back. Go on the other side. So skin integrity is clean, dry, and intact. The color is appropriate for his ethnicity. There are no deformities present. You can go ahead and put that back. His skin temperature was warm. And now I'm going to assess circulation. So I'm going to assess his bilateral pulses. So his dorsalis pedis pulses, they're both even, moderate to plus. And his posterior tibial pulses are bilateral, even, moderate to plus. I'm now looking at his toes. So his toes are well groomed and maintained. They're not clubbed. His toes are well groomed and maintained and not clubbed. His muscle size is equal and symmetrical for both of his legs. And now I'm going to assess capillary refill. Alright, capillary refill was less than 3 seconds. And now I'm going to do this one. Okay, capillary refill was less than 3 seconds on his right foot and then less than 3 seconds on his left foot as well. So now I am going to assess your motor function. So can you pull up? Okay, then push down like you're pushing down the gas pedal. Good job. So he has even function of his lower extremities. He has even and bilateral strength. So now I'm going to assess his fine motor skills. So can you wiggle your toes for me? Full range of motion on his fine motor skills on both feet and toes. Okay, now can you pedal your legs like you're on a bicycle? All right, good job. He has full range of motion on his lower extremities. His muscles are even and symmetrical in size. Now I'm going to do sensory. So I'm going to have you close your eyes and then you can tell me what toe I'm touching.
Pinky.
Okay.
Big toe.
Okay.
Pinky.
Okay.
Big toe.
Okay. He has full sensory, so now I'm going to palpate. I'm palpating for any deformities, masses, and tenderness. Are you tender?
Everything's good.
Okay. So I'm going to assess for edema now. He has no pitting edema. I'm going to do the same on the other side. Let me know if you're tender. Okay. You're tender?
No.
Okay. Non-tender, you can go ahead and put that down. And no edema on his feet and his legs. So now, do you have any problems with your feet? Do you have like tingling in your toes?
No.
Okay. Do you use assistive devices to walk?
No, I don't.
Okay. Do you have any concerns for me regarding your toes or your legs or your mobility?
No.
Okay, so now I'm gonna have you walk. I'm just gonna assess your gait. Here are your shoes.
What?
Yeah, walk down there and then come back to bed. So he is independent and steady. How often do you walk a day?
Every day?
Every day for how long?
You know.
An hour. Well, that's really good. That's a really good part of health promotion. Walking really helps maintain your muscle mass and your mobility. If you eat a lot of protein, that can help retain your muscle mass as well. Okay, do you have any concerns for me?
No, I don't.
Okay, well, you can go ahead and lay back down and be however you are was most comfortable. Your call light is within reach. It's right there. Your bed is in the lowest position. Just going to move your shoes to where you can get to them. Bed is in lowest position. The bed is locked on both blocks. I'm going to put your personal items within reach.
Okay.
Will you press your call light that's on your left-hand side if you need anything
I
from
will.
me? Okay. I'm going to sanitize my hands. And I'm going to document everything and my skills done.